I'm using lamivudine, sidofudine, and nefelipine, and I know they are all generic. From 2004, since today, I'm feeling great, I'm feeling good, I'm feeling as a mother, I'm feeling as somebody who is cared for.
Generic ARV from India has helped giving access to treatment because of cost, because of accessibility. If we reduce the source of those products, we are just killing the success of what has been done in the last 5 years.
In fact, I was much afraid because you remember some years back, the drugs were not much available, you know, and that could make anybody to be afraid. And it came a time when the drugs are much available. What I can say, I know that generic drugs are the cheapest ones, you see. It means that the affordable ones, which we are using even in our NGOs here, like Blue House, MSF France, and they are affordable for those people who are who don't have much money to pay.
Due to the relatively low costs of the ARTs in the last years, we were able to put more and more patients on treatment and continue treatment for them. This means for the single patient a huge improvement of the quality of life. Patients can work again, patients can bring up their children again. So it means we have a lot of hope for our patients, which would break away if we suddenly could not provide ARTs anymore due to high costs.
And if the generic drug can be stopped, like today, surely we can die. Because like me, I'm taking the drug B and one of my child. You see, if the drug will be cut off today, I can't be able to care for that children. I can't be able to care for me. I can't be able to be a family again. So it will make something unbelievable to happen in the world.
I think the people negotiating this free trade agreement between Europe and India should really take into consideration the impact of this agreement for the developing world. Here in Kenya, the government cannot afford to pay more money for ARTs, and therefore the current success of the program will severely be hampered through this, through higher prices for ARTs.
Come in a place like here in Bandare and see there is people who live positively. And the people who live positively are there, they have families, and they are working. So they have a right to live.